Is your bladder controlling your nights? If you find yourself waking up multiple times, know that this is more than a mere inconvenience. Many believe it's an inevitable part of aging, but I want you to see it differently. It's a warning signal from your body. Ignoring it is like ignoring the warning light on your car's dashboard. You might keep going for a while, but you're overlooking an underlying issue that can lead to serious consequences. In fact, what we call nocturia is linked to three hidden dangers. First, the risk of nighttime falls, which can lead to serious fractures. Second, your cardiovascular health. Each awakening causes a spike in blood pressure, overloading your heart night after night. And third, your brain. Interrupting deep sleep affects memory consolidation and mental clarity. Let's talk about the consequences of a fragmented night's sleep, that familiar brain fog, irritability, the exhaustion that follows you through the day. This chronic fatigue is more than just feeling tired. It's a systemic drain on your vitality, preventing you from enjoying your best years. But there's a powerful alternative to simply accepting this. The solution doesn't necessarily lie in a bottle of pills, but in the power of nutrition. The answer may be waiting in your kitchen. I'm Dr. Grace Prescott, and in this video, I'll detail 3 natural and effective foods that can fundamentally strengthen your bladder from the inside out. I'll explain the science behind each one, how they work, and the practical steps to integrate them into your routine to finally reclaim restorative sleep. It's time to move from exhaustion to revitalization. Let's get started. The hidden problem: why waking up to urinate is a critical health signal. Before we explore the solutions, it's essential to understand the underlying issue. The notion that waking up frequently to urinate is a normal part of aging is a misconception we need to correct. Accepting nocturia, the clinical term for this condition, is a critical mistake. It's the equivalent of seeing a persistent warning light on your car's dashboard and deciding to live with it. The underlying problem doesn't go away, it often worsens. And while it affects millions of adults over 60, I want to be clear, common is not the same as benign. Your body is signaling a deeper issue, and interrupting your sleep cycles has a systemic impact. Let's break down the 3 main risks. First, the immediate physical risk: falls. Moving in the dark while groggy significantly increases this danger. In fact, the National Association for Continence identifies nocturia as one of the leading risk factors for falls in older adults, which can lead to serious fractures. Second, cardiovascular stress. Each awakening triggers a physiological stress response, momentarily increasing heart rate and blood pressure. Over years, this chronic stress can contribute to hypertension and other significant cardiac conditions. Finally, the impact on cognitive health. Deep sleep is when the brain engages in a critical cleaning process, clearing out metabolic byproducts linked to neurodegenerative diseases like Alzheimer's. Fragmented sleep impairs this vital function, potentially contributing to memory issues and the brain fog many experience. The logical question is, what are the mechanisms behind this condition? The answer isn't about blame, but about physiology. There are concrete changes that occur in the body. Physiologically, bladder capacity may decrease with age, and the bladder wall muscle can become overactive. Hormonally, we see a reduction in the secretion of antidiuretic hormone ADH, which normally suppresses urine production during sleep. With lower ADH levels, the kidneys continue to produce urine at a higher rate, leading to awakenings. There are also anatomical factors. In men, benign prostatic hyperplasia can obstruct flow and prevent complete emptying. In women, the decline in estrogen after menopause affects the integrity of pelvic floor and urethral tissues. Finally, behavioral factors. Consuming fluids or bladder irritants, like caffeine, before bed conditions the body to interrupt sleep. Understanding these mechanisms is the first step to effective intervention. Now that we've defined the causes, let's arm ourselves with solutions. And our most effective tools are nutritional. Before we reveal the first one, if you value clear, evidence-based health information, I ask that you like this video and subscribe. Your support allows us to continue. Food number 1, the structural role of horsetail in bladder health. Let's dive into our first focus component. It's a plant known as Equisetum arvense, or horsetail. Its efficacy for urinary health lies in its unique mineral composition. The key component here is bioavailable silica. Horsetail is one of the most concentrated plant-based sources of this mineral. Silica is an essential precursor for collagen synthesis, the structural protein that provides integrity and elasticity to connective tissues, including the bladder wall and pelvic floor muscles. Collagen production declines with age, and supplementing with silica helps provide the necessary components for repairing and strengthening these tissues. Beyond structural support, horsetail has mild, astringent, and anti-inflammatory properties, which can help reduce bladder mucosa irritation, alleviating the sensation of urgency. It's crucial to understand its diuretic mechanism of action. While it may seem counterintuitive, its effect is gentle. Consumed during the day, it optimizes fluid elimination, preventing excessive accumulation that leads to bladder overload at night. Thus, the timing of intake is critical. Horsetail usage protocol. Form, infusion, or ideally decoction is the most effective method. Preparation. To maximize silica extraction, use the decoction method. Add 1 to 2 teaspoons of dried horsetail to a cup of cold water. Bring to a boil, then reduce heat and simmer for 5 to 10 minutes. Turn off, cover, and let steep for an additional 10 minutes. Strain before drinking. Dosage and timing. Consume 1 to 2 cups per day. I recommend intake in the morning and early afternoon, stopping no later than 5 p.m. to avoid nocturnal diuresis. Allow me to illustrate with a clinical example. A patient, James, 72 years old, presented with severe nocturia, experiencing 4 to 5 awakenings per night and significant daytime fatigue. Though initially skeptical, he adhered to the horsetail tea protocol. Within 2 weeks, he reported a notable improvement with only 1 awakening. After a month, he was consistently sleeping through the night. This demonstrates a fundamental principle. It's not a miracle, but about providing the body with the biochemical substrates needed for homeostasis. Important safety note: horsetail should not be used continuously for extended periods. The recommendation is a cycle of 3 to 4 weeks, followed by a 1-week break. Individuals with pre-existing kidney conditions or heart failure must consult their physician before starting use. Professional supervision is always the safest approach. Food number 2, the anti-inflammatory agent for the bladder. Let's move to our second functional food, a cruciferous vegetable, the radish. Its power against nocturia is based on 2 main properties: its anti-inflammatory effect and its urinary tract cleansing ability. Often, urinary urgency is a symptom of low-grade inflammation or a subclinical infection. Radishes contain sulfur compounds that give them their pungent flavor and possess notable antimicrobial properties. Regular consumption helps maintain a urinary environment less prone to bacterial growth. Additionally, radishes are an excellent source of vitamin C, a critical cofactor in collagen synthesis and tissue repair. The bladder walls require this support to maintain their integrity and function. Thus, if horsetail rebuilds the structure, the radish acts as a cleansing and repairing agent. Methods of dietary incorporation. Raw in salads, the most direct way to obtain its benefits. As a snack, a low glycemic, nutrient-rich alternative. Juices, in moderation, can be blended with other vegetables. Fermented, pickled. This option adds the benefit of probiotics, supporting gut health. In another case, a patient, Sarah, 68 years old, who suffered from constant urgency, integrated radishes into her daily diet. After a month, she reported a significant reduction in urgency and a drastic decrease in nocturia episodes. Caution: individuals with thyroid dysfunction should opt for cooked radishes, as heat deactivates goitrogenic compounds that may interfere with gland function. Food number 3, the urinary mucosa repairer. Our third and final food is a legume with an underappreciated but highly effective nutritional profile for urinary tract health, the pea, Pisum sativum. Its efficacy lies in 2 main components: its high content of vitamin A precursors and its plant-based protein. Let's analyze the first, vitamin A. This nutrient is critical for maintaining the integrity of the urothelial mucosa, the inner lining of the bladder. This mucosa acts as a protective barrier. Damage to this barrier can lead to chronic irritation and urgency. Peas are rich in beta-carotene, which the body converts to vitamin A, providing the substrate needed for regenerating and maintaining this crucial barrier. The second benefit is protein. Muscle function, including that of the pelvic floor muscles, depends on an adequate supply of amino acids. The pelvic floor acts as a support structure for the bladder. Age-related sarcopenia can weaken these muscles. The high-quality protein found in peas helps maintain muscle mass and tone, contributing to better urinary control. To recap the synergy, horsetail provides structural support, radish acts as an antimicrobial and anti-inflammatory agent, and peas promote mucosa repair and muscle support. Together, they form a comprehensive nutritional approach. Incorporation protocol: peas are easy to integrate into the diet. As a side dish, steamed to preserve nutrients. Added to soups and stews, enhances the nutritional value of the meal. Form of consumption: frozen peas are the preferred option. If using canned, select low-sodium varieties and rinse thoroughly before use. Consistency in intake is key to achieving therapeutic benefits. I recommend including them several times a week. Now that we've established the nutritional components, let's discuss the behavioral strategies that enhance their effects. Think of the foods as therapeutic agents and these strategies as the protocol ensuring maximum efficacy. Strategy 1: identifying bladder irritants. The efficacy of any diet is compromised by simultaneous intake of irritants. It's akin to administering an anti-inflammatory while maintaining exposure to the source of inflammation. The main ones to monitor are caffeine, a known bladder irritant, present in coffee, tea, sodas, and chocolate. I recommend ceasing consumption after noon. Alcohol has diuretic and irritant effects. Nighttime consumption is a significant contributing factor. Other factors: carbonated drinks, artificial sweeteners, high acidity foods, tomatoes, citrus, and capsaicin in spicy foods should also be evaluated. Recommendation: keep a 7-day intake and symptom diary to identify correlations and individual patterns. Strategy 2: strategic fluid management. Hydration is vital, but timing is crucial. Daytime dehydration leads to more concentrated urine, which is more irritating to the bladder mucosa. The protocol: concentrate most of your water intake in the morning and afternoon. Drastically reduce fluid intake 2 to 3 hours before bedtime. If thirsty, take only small sips. Strategy 3: bladder retraining. The bladder can be conditioned to retain urine for longer periods. The goal is to break the cycle of preventive urination. The technique: during the day, try to gradually increase the interval between urinations, starting with 15-minute increments. When you feel urgency, use distraction techniques and deep breathing to delay going to the bathroom. The goal is to achieve a comfortable interval of 2 to 4 hours. Strategy 4: pelvic floor strengthening. Kegel exercises are the gold standard for strengthening the musculature that supports the bladder. Muscle identification. To identify the correct muscles, try stopping the urine flow midstream. These are the pelvic floor muscles. Note: this is an identification maneuver, not the exercise itself. The exercise: with an empty bladder, contract the identified muscles for 3 to 5 seconds, followed by a 3 to 5 second relaxation. Perform 3 sets of 10 to 15 repetitions daily. Consistency is key to efficacy. In summary, the integration of horsetail, radish, and peas, combined with these 4 key strategies, constitutes a multifaceted and robust approach to managing nocturia. Now, I propose a practical 30-day challenge. Select at least one of the strategies we discussed. It could be the morning horsetail decoction, adding radishes to your diet, or implementing the nighttime fluid restriction rule. I encourage you to return to this video in 1 month and report your results in the comments section. Describe the changes, the outcomes. Your data and experience will not only validate your progress, but also inspire other members of this community to take control of their health. And of course, subscribe to stay updated on future insights into living a long, healthy, and high-performing life. What we've established today is that nocturia is not an inevitable condition, but a problem with identifiable causes and nature-based solutions. This isn't about weakness, but about a series of physiological and lifestyle factors that you have the power to influence. Remember our functional trio: horsetail for structural support, radish as an antimicrobial agent, and peas for mucosa repair and muscle support. However, the fundamental message goes beyond nutrition. It's about agency and sovereignty over your own health. You are not a victim of your physiology. You are the director of your well-being. You now possess the tools and knowledge. Refuse to accept interrupted nights and fatigued days as your new normal. Reclaim your right to restorative sleep and energy-filled days. The journey to tranquil nights begins with a single deliberate action. Start today. Your body and mind will thank you. Thank you for your attention. Stay informed and take care.